All right, if you've got a medical terminology exam breathing down your neck, you are in the right place. Think of this as your high-speed last-minute study session. We're going to break down the system you need to absolutely ace that test. So let's get right into it. Okay, let's just get this out of the way. You open the textbook and see, what, thousands of medical terms? Yeah, it's overwhelming. It feels totally impossible. Every student feels that stress, but I promise you, there is a much, much better way to handle this. And here's the big secret, the one thing you need to change in your thinking right now. Stop trying to memorize everything. This isn't about learning a whole new language from scratch. It's about cracking a code. And once you have the key to that code, well, you can unlock pretty much any term they throw at you. So here's our game plan. We're going to crack the code, look at the anatomy of a word, practice building and breaking them down, learn how to navigate the human body, and finish up with some essential medical shorthand. Let's go. All right, Section 1, cracking the medical code. You know, the secret here is that every single one of those long, scary-looking medical terms, it's really just a puzzle. It's built from just a few simple little building blocks. And this is it. This is the system. It's a simple 3-step formula you're going to use over and over again. Step 1, find the root. That's the core of the word. Step 2, look for a prefix at the beginning. And step 3, find the suffix at the end. That's the pattern, every single time. Root, prefix, suffix. Okay, so how do we actually use this code? Well, that brings us to the anatomy of a word. Seriously, you should think of these next few slides as your ultimate code book, your exam day cheat sheet. If you can master these key parts, you're going to be able to decode almost anything. First up, the root. This is the foundation, the main character of the story. It tells you the what, usually a body part. A perfect example is cardi. You see that, you should immediately think heart. It's the core meaning. Then you've got the prefix. This little piece comes at the very beginning of the word, and it just modifies the root. It adds some context, kind of like an adjective. It might tell you about direction or speed or quantity, like the prefix tacky. That always means fast. And the last piece of the puzzle is the suffix. This comes at the end of the word, and it tells you what's happening to the root. You know, is it a condition, a disease, a type of procedure? For example, itis. You have to know this one. It means inflammation, every single time. Okay, let's build that cheat sheet. These prefixes, you're going to see them everywhere. And here's a little pro tip for studying. Notice the pairs. Hyper is excessive, hypo is deficient. Tacky is fast, Brady is slow. Learning them as opposites makes them stick in your brain so much better. All right, now for the roots. These are the big ones, the core body parts you'll see over and over. Cardio is heart, gastro is stomach, hepa is liver. By the way, that little O you see, that's just a combining vowel. It's like glue to make the words sound smoother. Don't worry about it too much, just focus on the root itself. And here are some absolutely critical suffixes for your exam. Now, pay close attention here because these often tell you the diagnosis or the procedure, which are, really common test questions. So, itis is inflammation. Ectomy means surgical removal. Ology is the study of. These are what we call high-yield terms. You get a lot of bang for your buck by memorizing these. Okay, theory time is over. You've got your code book, you've got the keys. Now it's time to put your new skills to the test. Let's see how easy it is to break down some of these monster words. Okay, here's a big one. Osteoarthritis. Whoa, right? But don't panic. Let's use the system. First, what are the roots? We've got osteo, that's bone, and arth, that's joint. Okay, and the suffix? Itis, we know that one. It means inflammation. So let's just combine the meanings. Inflammation of the bone and joint. Look at that. You didn't have to memorize that huge word. You just solved it like a puzzle. Let's try another word real quick. Tachycardia. Okay, what do we see? Tachy at the front, that's fast. Cardi in the middle, that's heart. And that ia at the end, it just means a condition of. So put it together. A condition of a fast heart. See? The system just works. It's that simple. Okay, so knowing the word parts is huge, but you also have to be able to say where in the body something is happening. So think of this next part as the GPS of medical terminology. It's all about location, location, location. So for the abdomen, you'll see two main systems. There's a super detailed 9-region grid like a tic-tac-toe board, but honestly, for your exam, you're almost certainly going to need to know the 4-quadrant method. It's way more common. Just picture a big plus sign right over the belly button. That gives you a right upper quadrant, left upper quadrant, right lower, and left lower. Easy peasy. These directional terms are another must-know. And again, the trick is to learn them in pairs, as opposites. So anterior is front, posterior is back, superior is toward the head, inferior is away from the head, medial is toward the midline, lateral is away from the midline, and proximal is closer to the main trunk of the body, distal is more distant. Learn them as pairs, and they'll stick. All right, we're in the home stretch now. This is our last section, a final, rapid-fire rundown of the shorthand you absolutely need to know. Think of this as the final page of your exam cheat sheet. Okay, no messing around here. You have to know these. NPO, nothing by mouth. PRN, as needed. Stat, immediately. And please, please, please pay attention to BID and TID. They're for medication doses. Twice a day and 3 times a day. These are gimmies on an exam. Just easy points waiting for you to grab. So let's just pull this all together. If you only remember one thing, one single thing from our time here, make it this. The key is not memorization. It is all about understanding the system. Root, prefix, suffix. That's it. That's the whole game. So here it is, your final test day checklist. As you're walking into that room, just run through this in your head. Number 1, every term is just a puzzle. Number 2, you know the common parts, the roots, prefixes, and suffixes. Number 3, if you see a long word, you're not going to panic. You're going to break it down. And finally, you know your directions and your key abbreviations. You are ready. Look, you've got the system now. You have the code book. You're not just memorizing a bunch of random facts anymore. You're actually learning how to solve these puzzles. You've got this. So the only question left is, are you ready to go master the language of medicine?